prevent is primarily or secondarily. It's now we have come to a stage where all of us at least understand the language of investigations. My own thinking is, suppose I want to reduce weight from, say, 90 to 80 over a period of 1 year. That target is set for all the pathies. So which pathy does it how is up to that pathy, but the target is of reducing 10% of the original weight. Same is true for all the other parameters that we use for prevention, whether it is blood pressure reduction, whether it is heart rate reduction. I just give you the parameters also quickly. I'm sure most of you know about it. BMI should be about 23 for most primary or secondary. Blood pressure in most patients, except very elderly, should be below 135 systolic. That's the only thing we record. For most cardiac patients, the heart rate should be between 60 and 70 beats per minute. Then for most, it should be LDL cholesterol. We are talking about now only LDL cholesterol. The target should be as low as 55 if somebody already has a atherosclerotic cardiovascular disease. And if we look at other parameters, including the kidney disease and other things, my idea of preventive cardiology in a cross pathy is what pathy you use is not important. The result is important. And the result can be given by whatever pathy that we should lap up and produce results, shown the result, and then talk to the world that this is the method by which this kind of a result is possible. I'm glad so many of you are involved in presenting papers. That means you are thinking. If we keep doing allopathic research, then it is inventing the wheel again, because at present, at least the developed countries are a couple of years ahead of us. Whatever we do is a kind of a replication. We do try our bits in trying new things here and there, but our hope is in Ayurveda, because that is something which the world doesn't know. And we will have methods by which we can come up with fantastic solutions for these problems. We know that we are plagued with atherosclerosis as the largest killer in the world. And some discovery which will reduce this event rate, even with a small percentage, it's going to be a huge help to the world. So we should think of therapies, or which will think of methods by which we can bring these parameters of prevention to normal levels with reasonable safety. And also we should think of methods by which cure can happen. Like it would be a dream come true if somebody is atherosclerotic today and not atherosclerosis tomorrow. This does not exist in allopathy as of today. So if there is some hope, some way by which we can do this, it will be great. Take, for example, hypertension. Taking the medicine lifelong is not a very good idea. Say somebody starts off at the age of 35, 40 these days. So the next 40 years, somebody has to keep taking medicine. So we have to have some way by which cure can happen. So I think we should think in those lines and try to get cures. It is an unexplored science. So you have the ability and you have now the means of exploring them. So I am really excited to be with you all. My interest is mainly related to the India's pride, and secondly, we can find methods which are not known to the world. So let's hope this second conference spurs us some more. We've had PhD students who are doing some original research with MIPC. Let's hope their PhD subjects or thesis turns out to be something different. So all of you, I think, should be having that desire inside your heart to give something to the world. It's not just presenting a paper in this conference. It is a certificate that you will get anyway. But let it turn the tables for the whole world. In preventive cardiology, it is always any preventive method, it is said that a small change in a large community. That is what is important. Suppose the entire Maharashtra changes its some habit by 1%, it might result into reduction into so many angioplasties and bypass surgery. So this small change, what is it? Is it Panchakarma? Is it something else? Is it some method in Ayurveda? Is something which all of us should hunt, look for, and present to the world. Wish you all the very best. I think today we are approaching the fourth day, I think, of the conference. So let's hope something really concrete comes out, and in the years to come, we'll study more about it. Thank you very much for the invitation. I feel honored to be here with you all.
Thank you so much, sir. It is a privilege of ours to have your esteemed presence with us and your guidance. Yes, sir. All of us should work towards it, and definitely we should, achieve laurels not by becoming highest in the field of sufferers of heart disease. We should earn laurels in highest in the field of solvers of heart disease problem at the global level. So, sir, thank you so much for your lovely words. And with your due permission, let me, if you permit me, let me unveil the certificates that we are going to present to our participants today. And with your due permission, sir, shall I share the same?
Yes, please go.
So with the sir's due permission, let's go ahead and have a look at the certificates, which I somehow I'm right now testing my stress levels and BP because I'm not able to share the screen somehow. Let me just try and sharing it once again. Just a second, please. Okay. In the meantime, while I try once again to share it, it may just take a few seconds of my experimentation and trial. Sir, one in the meantime, if you permit me, may I ask you some question?
Yeah, please go ahead.
So now if you've seen, across the different topics, and when you talked about an amalgamated approach and blended approach towards different pathies, what would be the best way forward for our doctors who are now attending, who are seeing this? What would be the best way forwards if they would like to take it up and understand and move forward to better patient care and better patient solutions?
I think widening the horizons, that means how a patient is estimated or how the problem is judged. Probably allopathy today has excellent investigative methods, whether it is blood tests, whether it is X-rays, imaging, or thallium tests, or whatever. So the moment we widen these horizons and know about these investigations better, then you can suddenly think of a method which can reduce, say, a level of triglyceride. Suppose somebody has a level of triglycerides of 1,000 and an Ayurvedic method or a medicine for that matter brings it down to 200 with reasonable safety and economy. It will be a wonderful invention or discovery. So I think this way, all the pathies, if they were widened, and let's focus the investigation, let them be allopathic because they are approved world over. So our method should be means to reach there. Whatever method we use, whichever pathy we are, and today we are talking of Ayurveda, that method should bring that investigation level to normal. So they are more objective methods, they are computerized method, they are precise method, they are reproducible. So your treatment would be more authenticated if you can show that these investigations are getting better and that these results could be reproduced in various parts of the country.
Great, sir. Thank you so much, sir. And in this meantime, I've been able to sort out my technical issues. So that's the certificate. Let's have a big round of applause for our speakers. So that's the certificate for the chairpersons, and this is the certificate for the presenters. So thank you to all the presenters for being there, for presenting this in front of us, letting us all, enlightening us with your efforts, and to all the chairpersons for guiding us and mentoring us today. Thank you so much. And with this, I thank sir, I thank everyone who has been present, especially to the research team, Dr. Rahul Mandole, and the whole research team which has been there at the back end. And I invite now my dear friend, colleague, senior Dr. Prajakta Snodkar. Dr. Prajakta, ma'am, good evening and welcome. And Dr. Prajakta and Jagdish sir would be the chairpersons for the session ahead. Dr. Prajakta let me quickly introduce to you, Dr. Prajakta Snodkar is the clinic head at Madhabag in Mumbai Mira Road region. Plus, she's been winning the Dhanvantari Award of Madhabag for quite a few years now, an excellent person. When it comes to the field of preventive care, cardiac care, she's really worked a lot. So I hand over the session to Dr. Prajakta. Ma'am, over to you.
Thank you, Aman sir. Good evening, respected chairperson and all my fellow doctors. A very warm welcome to you all to this 8th and the last session of the 2nd National Ayurveda Cardiology Symposium. Friends, today we are really indeed and fortunate to have amongst us Dr. Jagdish Hiremath sir as chairperson to guide us and enlighten us. And our second chair, I would like to introduce you all to Dr. Rahul Mandole sir. Indeed, he doesn't require any introduction as such, but yet as a part of my job, I would like to introduce him. He is the key person behind the 2nd National Ayurveda Cardiology Symposium, Senior Research Associate, who takes care of the preclinical and the clinical cardiology research projects for Madhavbag. He is the one who has taught us, who has motivated us, including myself, what research is and how to make the PPTs, and encouraged us to present our research on such platforms. He has gathered more than 45 scientific publications and completed 2 RCTs till now. I would request Rahul sir to please guide us, give us some thoughts before we begin with our presentations for today.
Dr. Prajakta, very thank you for very nice and kind words. I'm thankful to Dr. Jagdish Hiremath sir for accepting the invitation. Rather, I'm thankful to you, sir, because under the MIPC, the Institute of Preventive Cardiology, the from MUHS, it was your initiative to start such kind of the platform for all the Ayurveda students, practitioner. So where the people from the different pathies will come and they will share the thoughts, they share the knowledge, experience. Because one thing I learned from my teacher that your eyes can't see what your mind doesn't know. So if you want to see, if you want to make our practice better, we should get exposed to some kind of the cardiology symposium or such kind of educational forum where our mind get trained to understand what are the possibilities and where I can take my clinical practice. And I am very glad, I'm very happy the way all the 103 presenters have presented their clinical cases, and the chairpersons have commented, chairpersons have suggested, guided all the presenters and the participants, even the participants and the delegates, they contributed in the question answer session. So at the end of the day, it's very fruitful symposium, I would say. And I request Dr. Hiremath sir to continue under the MIPC, as MIPC is for the education, research and awareness. So this comes under the research part of the MIPC. So we, sir, it will be very helpful for all of us if you can continue guide us for with such kind of a symposium in the future. And like this is a National Ayurveda Cardiology Symposium, we can expect the mule in the form of a non-communicable NCDs symposium if we are having in the future. That will be very helpful to share and discuss the knowledge about the prevention in the non-communicable disease as well. So without wasting any time, I request Dr. Prajakta to start with the presentations, so we can save the time. Thank you, Dr. Prajakta. Thank you, Dr. Hiremath sir and Dr. Aman Kapoor sir. I'm very thankful to you also for the beautiful valedictory, the start of the valedictory function.
Thank you, sir.
Thank you, sir. So with the kind permission of both the chairperson, I would like to start with today's 8th session of the 2nd National Cardiology Symposium. And I hope all the presenters are present and have joined the session. So a gentle reminder to all the presenters, you have to complete your presentations in 5 minutes. The last 1 minute would be for the question and answer session. And Pallavi ma'am would be sharing your PPTs. So you can just, if you haven't shared it with her till now, you can please get it done right now. So, I would like to invite our first presenter for the day, Dr. Vijay Dange. Sir, are you there?
Yeah, we can see.
You can unmute yourself.
I can't. Yes.
So all the best, doctor. Give your best.
Thank you. My name is Dr. Vijay Dange, Clinic Head, Madhoba Clinic, Talegaon. Am I audible?
Yes, you're audible, sir.
Yes. My presentation today is the role of Apatarpanjanya Ahar in the management of type 2 diabetes and its impact on HbA1c. Single case study. Next. Diabetes mellitus is becoming the fastest considerable disease in the world. India has been estimated with fastest growing population of diabetes. It is a metabolic disorder, may result in the deficiency or dysfunction of the insulin production. The preventive measures in Ayurveda can prevent the disease. The main causative factor is said to be sedentary lifestyle, food habits. In Ayurveda, it is described in Vata Pramayas, which can be managed conservatively with exercise, diet, and internal medication. Objective of study is to study the role of Apatarpanjanya Ahar in the management of type 2 diabetes and its impact on HbA1c. Next. My patient, his name is age is 67, male patient, is detected diabetes in 2013, 10 years before. On routine investigation, he started with gliptins and metformins. He went on insulin in 2020. His HbA1c increases 10.4 on 2021. In 2022, his HbA1c is 12.3. When he present in our clinic, his lifestyle was sedentary. He is shopkeeper. His previous history was obesity. His present complaint of general weakness. Patient's assessment, his BMI was 28.4. His abdomen curve 103, and his random sugar was 407. Heart rate 101. Next. Investigation done, HbA1c 12.3, investigation advice C-peptide and lipid profile. I came on diagnosis, that is type 2 DM, insulin resistance. First of all, I started with diet, that is 800 kilocalorie diet per day, with low carbohydrate, medium and moderate fiber, with oral medication, Haridra, Amalki and Daru Haridra, Panchakarma, Snehan, Svedan and Basti. Next. On SMBC monitoring, his weight, his glucose was monitored and his insulin was tapered along with I given him 15 set of Bastis. Next. On final result, his weight was reduced up to 10%, HbA1c reduced from 12.3 to 5.8. His insulin was stopped completely and he got better control on sugar. No any complaints. Still now his GTT is impaired. Chronic calorie excess leads to the accumulation of liver fat with eventual spillover into the pancreas. Fatty liver leads to the impaired insulin, impaired glucose metabolism, and increased export of VLDL triglyceride, which increased fat delivery to all tissues, including the islets. The liver and pancreas cycles drive onwards after diagnosis with steadily decreasing beta cell function. Ayurveda aspect, स्थूल प्रमेहि बलवानिकः पुरुषस्ततेकः परिदुर्बलस्य संभ्रूमणं तत्र पुरुषस्य कार्यं संशोधनं दोषबलाधिकस्य. Apatarpan, reduction in the body weight by diet control, vyayama, intermittent fasting, diet control 800 kilocalorie per day, calculated diet, cleansing therapies, that is Virachana, Basti, and medicine through anal route, that is Basti, with physical exercise. Next. In this study, it is proved that with Apatarpanjanya diet, insulin resistance can be removed and normal glucose metabolism can be restored with Dipan, Pachan, hepatoprotective, Strotoshodak, and Ruksha, Ushna, Tikshna Dravyas correct the digestion and improves the metabolism. If a person follows the proper routine along with this medication, it might be safe and effective for such cases, type 2 diabetes. Thank you.
Thank you, Dr. Vijay. Well in time. I would now request Dr. Hiremath, sir, if he has any questions for our presenter.
Yeah, actually, was his other medication other than insulin continued for diabetes during this treatment?
No, sir, it's tapered with SMDG.
Okay, and within a span of how many months this was achieved?
3 months total treatment times.
Okay. And I think the result definitely is dramatic. There is no doubt. Generally, we believe that once a person reaches insulin-dependent diabetes, there are hardly any beta cells left in the pancreas. But if it is reversed and the way it is resisting, there must be something beyond that that's happening. So it's just one case is always a spurring moment. More such cases, recurring cases, and duplication by others of the similar results is something which we look for. I congratulate for such a dramatic case. There can be some improvements in the presentation which can be dealt with sometime later. But it's a wonderful case. Thank you.
Rahul, sir, your comments, please.
Yes, congratulations, Dr. Vijay, sir. In the 90 days of span, you have achieved the HbA1c below 6. That is a commendable job, especially the patient with was on insulin. But what I'll suggest you to follow the patient for at least 3 years to claim it as a remission of type 2 diabetes. So that
Yes.
will be more scientific to go ahead with, and collect more and more cases, gather more and more evidence like this, and all the best for your future practice.
Thank you, sir. Thank you.
I would request both the chairperson to kindly share marks or grades to all presenters. And now I would like to invite our second presenter for the day, Dr. Bhagyeshri Kulkarni. Yes, Bhagyeshri ma'am, the screen is all yours.
Hello everyone. Good evening all. Hello.
Yes, ma'am. You're audible.
Am I audible? Okay.
Yes, you're audible.
Today's my topic is impact of weight loss. Impact of weight loss with Panchakarma in severe osteoarthritis with DM. Myself, Dr. Bhagyeshri Kulkarni, Project Clinic Head. Let's see the objectives. Obesity is the significant cause of various potentially serious diseases like severe osteoarthritis, type 2 DM, heart disease, thyroid disease, hypertension, stroke, digestive disorders, depression, anxiety, infertility. So weight loss is our first and primary aim of treatment. Thus, this topic is chosen by me. Next. Let's see the patient medical history. 50 years female patient, history of obesity and DM, location Varje Clinic, Pune. She is known case of obesity since 2010, hypothyroidism since 2015, osteoarthritis since 2017, and DM since 2020. Next. Let's see the case description. 50 years female patient, she is fond of catering, having catering business, known case of obesity, dyslipidemia, severe osteoarthritis, varicose veins, type 2 DM, hepatomegaly, and hypothyroidism. She has family history, mother obesity, thyroid dysfunction, father DM, and HTN. Her vital parameters are weight 102 kg, abdominal girth 113 centimeter, RBS 221, BP 119/85, pulse 98, SpO2 99. Next. Her present complaints when she came to our clinic, she was suffering from severe knee pain, both knees, unable to walk, stand, and sit, severe palpitation, dyspnea on exertion, grade 2, sweating, fatigue, weakness, bipedal edema, puffiness of face, swelling all over the body, insomnia, depression, nocturnal micturition, and chest discomfort. The investigations advised fasting, PP, blood sugar, HbA1c, total cholesterol, triglycerides, HDL, LDL, and all the lipid parameters, T3, T4, TSH, serum creatinine, vitamin B12, and vitamin D3. Her previous HbA1c was 8.6. Next. Diagnosis: severe osteoarthritis, obesity, hypothyroidism, type 2 DM, and dyslipidemia. Next. The treatment we have given: oral medications, use of Deepan Pachan, Medohara, antilipidemic cardioprotective drugs like Duxambla, Guduchi, Musta, Triphala, etc. Dhatu Poshak, Krimihara, Strotorodahara, hepatoprotective anti-diabetic drugs like Neem, Gudmar, Caravellak, Arjun, and Lashun. Also, I have used some Vatanashak drugs like Yogaraj Gugul, Rasna Sevan, etc. Diet we have given that 800 kilocalorie diet, low calorie, high protein, high fiber diabetic diet with fruits, vegetables rich in antioxidants. Panchakarma we have given centripetal oleation, that is Snehana with neem oil, Svedana with Dashamulak Vatha, PRDA Basti with Gudamar, GDY Quat. And also we have given SSPS, that is Pinda Sved, locally for both needs. Next. The result: objective parameters, weight reduction 3 months, weight reduction in 3 months, 11 kg, HbA1c before 8.6, after treatment it is 6.6. Lipid parameters are cholesterol 92, triglycerides 200, SGPT, SGO2 normal, T3, T4, TH normal, abdominal girth reduced to 92, and her blood sugar is reduced. Subjective parameters we got: knee pain reduced by 80%. Patient can now easily walk 3 kilometers per day. She can stand for more than 5 hours in a day. Now she is very comfortable in sitting down. Patient has become more enthusiastic, efficient, and proactive. No fatigue, no weakness. When she came to us, she was very depressed, and she told her present complaint that, "Doctor, please mala severe knee pain madun bahar kada." Now let's see the conclusion. Overweight, obesity is the basic cause of many serious lifestyle diseases. In this case, due to her overweight, she has developed severe osteoarthritis. So she was unable to walk, do exercise, yoga. So we treated her obesity first with the Panchakarma, oral medication, and lifestyle modification. With the help of local SSPS, we improved her muscle strength, nourishment of bones. SSPS gave analgesic anti-inflammatory action, reducing her muscle stiffness. After 11 to 12 kg weight loss, her metabolism improved, HbA1c reduced, lipid parameters improved, energy levels boost, no insomnia, no fatigue, depression, nocturnal micturition reduced. Overall, it shows the powerful impact of weight loss with Panchakarma in severe osteoarthritis and DM. Next. Thank you so much.
Indeed, you brought a smile on her face, doctor. So your comments, please.
So basically, congratulations, Dr. Bhagyashree Kulkarni, for a
Thank
very
you so much,
fantastic
sir.
result. And because when the subjective parameters on a subjective parameter, when the patient is happy, then everything is good.
Yes, sir.
So fantastic result. But one point where I'll suggest we should not reveal patient's identity. You have
okay.
shown the photography of your patient.
Okay. Okay,
That
sir.
is ethically not correct. So
Okay, sir.
please take care of that and for your next presentation. So overall, thank you. No questions at all.
Okay, sir. Okay.
I have
Thank you so
one-
much, sir. This is my
Yes,
first
yes,
year
Raman.
of presentation. And I'm very much thankful to research team, Rahul sir, and all my mentors to give this opportunity to me. Thank you so much.
Meanwhile, Dr. Bhaswati ma'am has asked you a few questions in the chat box, and I think this is a very nice way to interact with Dr. Bhaswati ma'am. You should go to chat box and try to answer the question what ma'am has asked. Yes,
Okay,
Aman
sir,
sir,
sure.
you are supposed to ask.
Yes. So, Dr. Bhageshri, along with the weight loss program, have you added some form of exercises for her knee?
Yes, sir. We have given her our knee care plan to her. Also, I have advised some yoga asanas to her. Also, strength training exercises I have given to her.
Okay. Okay. Great. Great. Good going, Dr. Bhageshri.
Thank you, Dr. Bhageshri.
Thank you so much. Thank you. Thank you.
Now I would like to invite our next presenter for the day, Dr. Shweta Singh. Yes, Shweta ma'am.
This is my old slide. I want a new one. Palvi ma'am,
Yes.
this is the old presentation. I want the new one.
Dr. Shweta, you have the presentation ready with you right now on your
Yeah.
screen?
Yes, sir.
Can you share it from your own laptop?
Yes, sir.
So you can do that immediately. That will immediately sort out a lot of stress for everybody, and BP levels also reduce. So try to share it from your screen. Fantastic. Okay, so it will take a few seconds for the screen sharing to start, and it also depends sometimes on the net speed. There it is. Just put it on a full screen mode. Press F5. Fantastic. Awesome. Over to you. Just press F5 or full screen mode. Fantastic. Okay. Has it gone to full screen mode? Yes. Perfect. So over to you, Dr. Shweta.
Yeah. Good evening, everyone. I am Dr. Shweta Singh, and I am clinic head at Kidwai Nagar, Kanpur. The topic of my presentation today is to study the efficacy of Langhan Chikitsa in stable angina. Angina is a chest pain, usually due to the insufficient supply to myocardium. It is most commonly a symptom of coronary artery disease. The subject of my study is a 59-year-old male patient with history of CAD and MI. In 2016, the patient suffered MI and was diagnosed with CAD. After that, he had recurrent episodes of angina, and in 2019, he has undergone PTCA. Even after PTCA, he had angina symptoms, and in 2021 June, he was admitted to the hospital with the complaint of severe chest pain. CAG was done, in which 90% blockage was detected in RC and LCX, and his EF was 45%. The patient was given conservative treatment and discharged. The patient of insomnia, constipation, hyperacidity, fatigue, loss of appetite, and frequent urination. I would like to bring to your attention the symptoms of this patient. The symptoms are of typical Tridosha Hridrog. These medications of the patient. The patient had arrived at my clinic with some investigations, and the investigation that I had advised was stress test according to modified Bruce protocol and HbA1c. The diagnosis was CHF with IHD and diabetes mellitus. The treatment consisted of oral medication, diet, and Panchakarma. In oral medication, he was given Arjun tablet and Quat, which was later replaced with Arjun Shirpak and Arista. Gokshur, Haridra, and Amalki capsule was given. Panchkol Churn Siddh with Dadimastu was given. Daru Haridra, and Amalki capsule was given along with Deepan Pachan Dravyas. The diet consisted of low carb and high protein with low glycemic index supplemented with raw fruits and vegetables rich in antioxidants. The Panchakarma consisted of Snehan, Svedan, Vasti, Hridayadhara, and a weekly Virachan. The Snehan was done with sesame oil infused with Arjun. Svedan was done with the Shmul Kada. Basti was done with the Quat of Arjun and Punanava. Hridayadhara was done with the Shmul Quat, and the weekly Virachan was done with castor oil infused with Triphala and Shunti. Since there was not a significant relief in angina, Langhan was planned. And in Langhan, one day complete Langhan was followed by 8 days Lagu Ahar. According to Charak Samhita Chikitsa Sthan 26, Langhan should be primarily given in a 3 dosha Hridrog, and Ahar and Aushad should be followed according to the doshas. The Lagu Ahar Yojana was like this. The breakfast and dinner options consisted of kuttu flour chila or samak rice or puffed rajgira upma. Lunch consisted of mixed fruits, cucumber salad, pumpkin soup, and green tea was advised in morning and evening. This is the treatment with timeline. In 60 days, the patient was GTT negative, but he could not get rid of his tobacco chewing addiction. Since there was no marked relief in angina, the Langhan procedure was followed. These are the parameters before and after. The peculiarity in this case was that on stress test, I did not notice any angina. The patient was having angina only when he was driving. So on the stress test, he exercised for 30 minutes before the treatment, and VO2 max was 30 ml per kg per minute. Lateral wall ischemia was noted, and the symptoms consisted of heaviness in chest pain and dyspnea. After the treatment, the patient exercised for 15 minutes, VO2 max was 36.5 minutes, and no ischemia was there, and no symptoms were there. The coronary angiography reports before the treatment showed 90% blockage in RCA and LCX and its branches with the stent in LAD. After the treatment, LCX and LCX blockage was reduced to 50 to 70%, and its branches showed no plaque. In RCA, the plaque was more than 70%. Ejection fraction improved from 45% to 55%. Before the treatment, there was hypokinesia in LAD territory, and after the treatment, there was no regional wall motion abnormality. These are the reports for your reference. The conclusion is that even there were improvement in the parameters and all the investigation, but symptomatically the patient was not relieved of his symptoms. That is angina. Means he when he came, he told me that angina surfaced when he was driving. So at one point of time, he clearly said that you people are good in diabetes, but your treatment doesn't work on heart. So that was something very disheartening. So I resorted to Charak Samhita, and I just tried this Langhan Chikitsa, and I was not sure whether it will work or not. So I just gave this one-day treatment of Langhan, and I just linked it with the patient was religious and used to worship for 1 hour every day. So I linked it with his Navratri fast. So the patient agreed to fast, and thankfully I got the result. But I'm not sure that it will work in every patient. So I would need furthermore evidence to prove this. These are the references. Thank you.
Excellent execution, ma'am. And today the whole world is looking up to Ayurveda, and I think cases like this would boost everybody's confidence. Over to you, Rahul sir. Any questions for presenter?
Not a question, but I would like to appreciate the way you thought upon this case. Basically, when we don't get a desired result, and when we go back and we learn whatever the principle that we have learned of Ayurveda, and we start implementing those principles and getting results, nothing like it. And that same thing happened in your case. You able to regress the patient's blockages or the coronary stenosis by almost by 20-25% in the RCA and LCX, and that is the fantabulous thing what I have observed. We are missing Dr. Jagdish Hiremath sir here, but he would have been very proud of you the way you have executed this case, and all the best and congratulations once again.
Thank you, sir.
Moving on to our next presenter for the day, Dr. Sandeep Tripathi. Yes, Sandeep sir. The screen is all yours.
Good evening, everyone. I'm Dr. Sandeep Tripathi, Clinic Head of Madhavag, Surupnagar, Kanpur branch. My objectives are HbA1c reduction, weight reduction, heart rate reduction, reduction in physical aggression. Patient is suffering from hypertension since 2011. After a long period of STM, he is suffering from diabetes and coronary artery disease and hypercholesteremia in last 3 years. Patient detail 42-year male patient with a history of STN from last 12 years, also suffering from diabetes, coronary artery disease, hypercholesteremia. Patient chief complaints are headache, physical aggression, high blood pressure rate, high pulse rate, dyspnea or exhaustion, frequent urination, constipation, and hyperacidity. Investigation done in clinic first day, HbA1c, APPM, treadmill test, liver profile, CBC, amylase, vitamin B12, vitamin D, HSCRP, LFT, KFT, urine routine, thyroid profile. Oral medication for patient, it's Sanpushpi, Asugandha, Sarvgandha, Pushkar Mool, Satavar, Vacha, and Trikatu, Pipli, Vanslochan, Dalchini, Ilaichi, Hingu, Kalji, Jila, Pipli, Sunti, Bilbo, Arjun, and Purnanavacha. Diet is restricted from outside. Only diet provided by us is low carbohydrate diet, low salt intake, low glycemic diet, high protein diet with the vegetables and the low glycemic food. Panchakarma done at the clinic, Snehan with the neem oil and arjun oil, Sweden with Dasmul Kadha, Hedadhara with Dasmul Kadha, Sirodhara with Jada Mansi Kwat, and Vasti with Gurma, Daruha with the Yastimatu and Arjun. Virechan done by Amliki, Vividki, Haritki, Sunti, and castor oil. Duration for Panchakarma for 15 days, 3 Panchakarma and 3 Virechan done after this weekly Panchakarma and Virechan proceed. In the Virechan criteria, we are using it from first day, that 10 ml of castor oil for the patient. And we are recorded and observe in my observation that patient tell us about the Begaj. In first 3 Virechans, we are recorded 6 to 8 Begaj, and then after is 2 to 4. In 6 March 2023, the patient weight was 98.7, abdominal girth 116. Pulse 106, fasting 160, RBS 226, BP was 145/99, and BMI was 30.7. After 40 days treatment, we are again check it, and weight was 88.2, abdominal girth 105, pulse was 62, fasting 87, RBS 117, BP 117 upon 74, BMI was 26.8. Weight reduction in 40 days, the weight reduction is 10.5 and AG reduction is 11 centimeter. Investigations are done in first days. Lipid profile was 150, triglyceride 161, HDL is 30, LDL 87, VLDL is 32. After 38 days, lipid profile was 131, triglyceride 123. HDL was 42, LDL was 87, VLDL is 24. HbA1c reduction, first day HbA1c 7.3, and after 38 days is 5.6. ABPM first day reading was all average BP is 128 upon 85. Day average BP was 131/88. Night is 131/73. After 38 days, and patient is also diagnosed with the stage 1 hypertension. Or after 38 days, we are again reading of the ABPM 117 and 75. 118 is 76 day BP, and night is 11 and 11 upon 70. And there is no evidence of hypertension. Vitamin B12 was 148, and after 38 days, vitamin B12 was 332. Our next investigation, TMT treadmill test, first day His VO2 max was 25.55. Termination criteria was dizzy on exertion, heaviness in chest and fatigue. After
Last 1 minute, doctor. You can go ahead.
After 40 days, the VO2 max was 36.05. Test completed without any complication. Conclusion: Snehan, Sweden, Basti, Sivrodhara, Hedadhara, VHN, and diet management can help to improve elasticity of the blood vessels, reduce blood viscosity, improve strength of heart muscles. Thank you. Patient is mostly suffering from the tachycardia. Patient most complaint is the pulse rate was every time is high and blood pressure is never been reduced down 120. Then right now he's when he's checked his BP, he knows that my BP is in normal range. Thank you.
Thank you, sir. And I would request Rahul sir to, if he has any questions for presenter.
Dr. Sandeep, fantastic result, I would say. And I think if you can take me to that slide where you was trying to show the results in the change in the blood pressure, in especially in the ABPM. Can you, Pallavi, can you please share that slide again? Because you, I will not say you missed that point, but that is the point which was very crucial, and that could be the best point that any BMS student or practitioner could feel proud कि आपने जो किया है, आपने जो result दिया है. So directly go to the result part. Now here what we can see in the ABPM result especially, आपका treatment principle is bang on. No, there is no question at all the way you have managed the patient. But the result what you have get here, you can see the day BP average is systolic BP is 131. Even the night systolic BP is 131. So we call it as a reverse dipping pattern or a non-dipping. Absolutely no dipping at all. Right, so that means his body was continuously into the pressure, the blood pressure. This is the reason, and this is a very fatal condition. Yes, absolutely fatal condition. And after treatment, you can see the day BP is 118 and night BP is almost 111. So it's a significant reduction in his night BP as compared to the day BP. So the whatever the reverse dipping pattern was observed in the day one has completely reversed here. And this is something, the fantastic work that your treatment principles had did. And I just had a question. Before starting treatment, patient was on a statin?
Sir?
Yeah, whether the patient was on a statin?
Yes, sir. No, sir. No medication taken by patient.
No statin.
Only tell me certain 20 mg.
Okay. Fine. So that is the only point I wanted to highlight here. And fantastic, and hats off. Congratulations once again.
Thank you, sir.
Thank you, Dr. Sandeep. And moving on to our next presenter for the day, Dr. Jagdish Hiremath. Yes, ma'am.
Yes. Thank you, ma'am. Good evening, all mentors and all presenters. बहुत ही बढ़िया सेशन चालू है. एक्चुअली ये सब जो हमारे प्रेजेंटेशंस है ये स्वर्ण अक्षरों में लिखे जाएंगे नई पीढ़ी के लिए, और नई पीढ़ी जो है नेक्स्ट जनरेशन वो हमें नहीं कोसेगी कि हम लोगों ने हमारा नॉलेज आगे फॉरवर्ड नहीं किया है. तो ये प्लेटफॉर्म हमें माधव बाग ने दिया है. So thank you for sir. Let's start my presentation. My topic is efficacy of Ayurvedic management in reversing type 2 diabetes, a retrospective study of 45 patients using GTT test. Dr. Jagdish Hiremath, on the clinic head. Introduction. Diabetes mellitus is a chronic metabolic disorder characterized by hyperglycemia results from defects in insulin secretion, insulin action, or both. Oral hypoglycemic agents have limited mechanism of action and lack of target specificity, solubility, and permeability. Complications cannot be prevented, and side effects of modern drug therapy increase day by day. Progressive insulin resistance and beta cell failure cannot be stopped. This is treating up to failure by increasing OH doses. Next slide, please. Pathophysiology as per Ayurveda, medascha mausascha sharirajam, chakledam kafo bastigatam pradusha karoti mehana samuddiranam ushnasthaneva pittam paridusha chapi. Kapha vitiated meda means fat tissue, mounsa, muscle tissue, and clade, liquid elements of the body located in basti means urinary tract, causes the different types of diabetes. Prameha, we treated type 2 diabetes only, Stula prameha and Krusha pramehi. Next slide, please. Classification and prognosis. Sadhyaha kafotha dasha, pittaja shatayapyaha, न साध्यः पवनाश्चतुष्काः समक्रियत्वात् विषमक्रियत्वात् न महात्यत्वाच्च यथाक्रमन्ते. कफच प्रमेह which is very easy to treat, sadhya, overweight patient, newly detected patient, less OHA dependency patients. Pittach prameha which is hard to previous slide please. Pittach prameha which is hard to reverse, it is yapya, obese patients category, chronic patients and complicated patients. Vatach prameha means totally insulin dependent diabetes. Next slide, please. Materials and methods. Study design, retrospective cohort study, study period 30 to 90 days, study participants, patients suffering from type 2 diabetes, sample size 45 patients, advising all the patients adjuvant herbs, diet, panchakarma, exercise and lifestyle modifications. Next, please. Materials and methods. Medicines, adjuvants herbs in Ayurveda, we use like Deepan, Pachan, Pramehagna, Medogna, Kledagna, Mutradoshagna, Nidrajanan, and Lekhan medicines, etc. Panchakarma, detoxification, it includes Snehan, centripetal oleation, Swedan, thermal vasodilatation, Basti, perrectal drug administration, Shirodhara, frontal drip, Hridayadhara, thoracic drip, Virechan, purgation, Nasya, nasal drops, etc. Diet box loaded with Ayurvedic medicated tasty food combination, ready to cook, portion control, low carbs, low fat, moderate protein, high fiber, and 800 to 1000 kilocalorie ahar. Exercises, we advise aerobic exercise, resistance, strength training, flexibility exercise, balance exercise, alternative high intensity interval training. It promotes the rapid enhancement of skeletal muscle oxidative capacity, insulin sensitivity, and control glycemic index. Monitoring. Strong digital monitoring with the help of MIB Pulse app. It is health meter, calculate risk, and also gives the notification to your health, highly qualified doctors of Madhobag and help anybody who is in need of medical assistance. Next, please. Next slide, please. So the results are, this is the average statistical parameters. Weight reduces 75.51 kg to 69 kg, 96.7 centimeter abdominal girth reduces to 88.9 centimeter, BMI 29.9 reduces to 27.3, HbA1c 7.1% to reduces to 6.1%. GTT results also we can see. Next slide, please. Among 45 patients, 35 patients are GTT negative, 7 patients are impaired, and 3 patients got GTT positive. 80% of patients attempt GTT test and get reversed within 75 days. The p-value in the parameters are significant. It already shown in the graph. And this is some snaps of GTT event. हमारे यहाँ पेशेंट्स को हम लोग दिवाली जैसे सेलिब्रेशन के लिए बोलते हैं और उस दिन हम लोग भी पेशेंट के साथ वॉकिंग के लिए बाहर निकलते हैं या फिर स्ट्रेस टेस्ट ट्रेडमिल पे हम उनको भी चलाते हैं और हम भी खुद चलते हैं तो पेशेंट इंस्पायर होते हैं इस सब टेस्ट के लिए. नेक्स्ट स्लाइड प्लीज. डिस्कशन पार्ट. Effect on insulin. Sanchodhan therapy like Virechan, Basti has significant role in Samprapti Vigatan of Madhumeha by Agnivriddhi and Strotoshodhan effect. It activates the insulin secretion as well as the reduces peripheral insulin resistance. Effect on liver. It shows that Ayurvedic management increases the activities of enzymes responsible for utilization of glucose and reverses the pathological changes in liver. Effect on adipose tissue. Level of circulating adipose tissue in type 2 diabetes resulting in oxidative stress, insulin resistance, and platelet activation. Weight loss reduces inflammatory response in adipose tissue. It also reduces the cellular stress, extracellular matrix remodeling, adipokine secretion, and lipolysis. Next slide, please.
Last 30 seconds.
Yes, sir. Yes, ma'am. So come to the conclusion, need to find alternative management protocols by combining different alternative methods such as Ayurvedic Panchakarma diet has been proven effective in managing type 2 diabetes, reducing the OH and insulin burden along with the achieving glycemic control. Oral glucose tolerance test is used not only to diagnose the diabetes, but also helps to provide the additional information about the body's ability to metabolize the blood glucose. Factors like chronicity of disease, stress, poor compliance to diet and exercise, sedentary lifestyle, obesity, aging, disturbed sleep pattern, habits like smoking are the challenges that need more to work on it. Combined approach is must, means to check the standard parameters with Ayurvedic treatment to successfully tackle a seemingly unbeatable disease like diabetes and its complications. Next slide, please. These are the references. Next. This is our team. Next. Thank you so much, sir.
Thank you, Dr. Jyoti, for this awesome presentation. Over to you, Rahul sir. Any questions for our presenter?
Dr. Jyoti, amazing presentation. In your earlier few slides, you have shown the sadhya sadhyatva of prameha.
Yes.
And in your result part, you have shown some of your patient get rid of GTT is negative in some patient, it is the intermediate, or in some patient it is still positive. So have you correlate as per the sadhya sadhyatva of a prameha and the outcome of a GTT?
Yes, sir. Actually साध्या साध्यत्व के लिए हम पेशेंट को फर्स्ट तो पेशेंट की कैटेगरी क्या है, स्टेज क्या है, पेशेंट का कितने दिन से पेशेंट को डायबिटीज है, इन सब के ऊपर ही हम साध्य साध्यत्व डिसाइड कर सकते हैं.
My question is very straight. When you say Swataj Prameha, Pittaj Prameha, or Kapach Prameha, so have you categorized all the 45 patients in that class, and then you correlate it with your outcome of GTT?
Yes, sir. हमने पेशेंट सिर्फ साध्य कैटेगरी के ही लिए थे, मींस टाइप 2 डायबिटीज, उनमें 2 कैटेगरी ओबेस एंड लो बीएमआई पेशेंट्स थे.
Okay.
तो हमने इंसुलिन डिपेंडेंट पेशेंट जीटीटी के लिए लिए ही नहीं सर. ये पूरा कोहॉर्ट स्टडी सिर्फ टाइप 2 डायबिटीज के लिए है.
Okay. Then it is beautiful, fantastic result and well presented. Congratulations to you.
Thank you, sir.
Thank you, Dr. Jyoti. And moving on to our next presenter, Dr. Asha Lakaria. Asha ma'am, are you there? Yes.
Yes, ma'am. Yes, ma'am.
Yeah, the screen is all yours, and all the best.
Thank you very much. Am I audible?
Yes, you're audible, ma'am.
Yes. My topic is impact of Panchasutra treatment in multiple chronic conditions. I am Dr. Asha Lakaria, compliance doctor from Madhova Clinic out with my clinic head, Madam Dr. Jagdish Hiremath. Objective of my study to assess the effect of an integrated approach of Ayurvedic treatment, herbal medicine, yoga and exercise, diet management, and modern monitoring on improving quality of life, reducing symptoms of chronic disease like hypertension, diabetes, hypothyroidism, and osteoarthritis in a case study. Next slide. Patient medical history is like that. 2007, patient have knee arthritis with obesity. In 2021, she have hypertension with hypothyroidism. In 2022, she diagnosed with diabetes. Next slide. A case description. A 67-year-old female patient with history of 3 FTMD, 2 abortion, fissure was operated, menopause 5 years back, complaining of dyspnea grade 3, both knee swelling, pedal edema, pitting. Patient assessment was like that. Weight was 75.9 kg. Abdomen girth was 99 centimeter. BP was 130/80. Random blood sugar was 147, and she was on 8 allopathic medicine. Next slide. Investigation with patient was such like vitamin B12 was 186, HbA1c was 6.4, eGFR was 68, and she have knee X-ray, osteoarthritis grade 3. Next slide. Investigation advised by us: HbA1c, lipid profile, eGFR, Turico with GLS, ABPM, thyroid profile, anti-TPO, and both knee X-ray. Next. Diagnosis in this case was obesity, diabetes, hypertension, hypothyroidism, and knee arthritis. Next. Oral medications here we use here polyherbal combinations of Yograj, Gugur, Arjunarishta, Meshashungi, Amalaki, Gokshur, Haridra, Rasna, Shunti, and etc. Diet here we use portion control diet with 800 calorie balanced diet, low carb, rich lentil, limited saturated fat was advised with low glycemic index food, and fruit and green vegetables were advised. Knee exercise, especially first we advise knee exercise where muscle strength training, balance training, flexibility exercise, yoga and meditation, pranayam and aerobic exercise was advised. Panchakarma, we use Snehan centripetal external olivation with arjun oil, rose oil, neem oil, and vatari oil was used. Swedan, passive heat therapy with Dashmul Kaur, 10 to 15 minutes. Basti, per rectal drug administration, JDY and ARJ Basti. Shirodhara, which is slowly and steadily dripping medicated decotations on the forehead with Jatamansi Kaur. Hrudaydhara, medicated decotation dripping on medial mediastinum region with Dashmul Kaur. Janu Basti, medicated oil poured and pulled for fixed duration of time in a compartment around knee joint with vatari oil. Next. Here the result we got after the treatment: weight reduced by 6.5 kg, BMI reduced by 2.6, HbA1c reduced by 1.2, and patient get GTT pass. In ABPM result, patient first was in stage 1 hypertension, which was get elevated result. EGFR, which was before 67, then it got result 96.35. Anti-TPO was 70.75, which was got 31.2 after treatment of thyroid. Knee joint, swelling, pain, patient was unable to walk before. Now, no swelling, no pain, and patient is comfortably walking. Dyspnea from grade 3 to 0, no dyspnea. Pedal edema also reduced, and no pitting pedal edema. And dependency on allopathic medicine from 8 medicine to 0. Next slide. These are some GLS improvement in GLS score, GLS perfusion after the treatment. Next. These are knee X-ray. Patient have symptomatic relief. Patient pain and edema is reduced. Next. As per Sushruta, Tesham Sanshodhana Sanshamana Ahara Acharaha Samyak Prayukta Nigraha Hetava. The management of multiple chronic disease can be challenging for both patient and health professionals. Diet, exercise, Ayurvedic treatment, herbal medicine, and modern monitoring are among the most commonly used approaches for managing chronic conditions. Next. Conclusion in this case is managing multiple chronic diseases requires a multifaceted approach that includes diet, exercise, Ayurvedic treatment, herbal medicine, and modern monitoring like Panchasutri treatment. Each of these approaches has unique benefits which helps to improve patients' quality of life and dependency on allopathic medicine. Next. Thank you very much. These are the references and this is our team. Thank you very much.
Well, in 5 minutes, exactly 5 minutes. Very well executed, doctor. And Rahul, any questions?
Dr. Asha, I have a very simple question for you. आपने इस पेशेंट से कितने पैसे लिए थे?
पैसे?
हाँ, how much this treatment cost to this patient?
50,000.
50,000. So basically, I would like to congratulate on one part also. We are living in a country where people don't have that much of money for their healthcare. They cannot spend that much of money for the healthcare. Now, if at all this patient has gone to the various specialty doctors, he would have spent like maybe more than 3, 5, 6 lakh, right? Because he had so many chronic problems. He has to go to some rheumatologist. He might have go to some cardiac doctor, maybe endocrinologist. So everyone may have charged him different, and the way you have managed this patient, your multifaceted approach, what you really term it very nicely, it's very beautiful way, and not only beautiful, it's a very noble approach and very cost-effective approach for the patient. So definitely a lot of blessings to you, and congratulate to you and your team once again. Thank you.
Thank you. Thank you very much.
Thank you, doctor. And rightly said, sir. We all doctors in Madhavwad, under the guidance of Rohit sir, are treating the patients under one roof for various diseases. And it's not only like cardiology, we even take care of their cold cough. So, so thank you, sir. And moving on to our next presenter, Dr. Rohini Shinde. Rohini ma'am. Yes, the mic and the camera is all yours, ma'am.
Oh,
And you can
please
go
allow
ahead.
me to share my PPT. Okay. Sorry. Hello everyone, myself Dr. Rohini Shinde from Fatima Nagar Clinic. I'm here to present why we have to study about cardiology and medical genetics, the importance of cardiology and medical genetics. Genetics, family history taking, genetical counseling, and next slide, please. Next slide. And what is the relationship between diet, exercise, lifestyle disorders that we should change with respect to genetics that we observe in the cardiological diseases to get rid of the diseases which were not previously found in any religion, any human beings, but nowadays we see every now and then even young people get diseases. Almost 100% of the cardiovascular diseases we see, 40% are at risk because of genetic disorders, genetically modified or genetically transferred diseases. And prevalence rate, if you see in urban and rural, it has been compared. By the end, if you see the control area, the prevention is very low, very low. The treatment is quite good, but still the prevention rate is very low. So we as a fellow of cardiology and preventive courses, we are here to make sure that there is much of prevention than treatment. Towards such approach, I am presenting this medical genetics and cardiology today. Next, please. There are several types of medical diseases, cardiovascular diseases, DCM, CMT, hypertension, atherosclerosis, rheumatoid arthritis. Next slide. N number of diseases that goes on and on with the genetic diseases that is linked with the cardiovascular diseases. Pallavi ma'am, next slide, please. So how we can apply this factors to our practice is by genetic risk factor assessment, genetic testing, genetic counseling, history taking of 3 generations, lifestyle disorders, if any, seen, lab testing that has to be changed, guidance to the patient and the family. Since the environment factor cannot be controlled by us, but the diet and lifestyle disorder obviously can be controlled by us. That is where we are going to focus. Next slide, please. Genetic testing is the lab genetic testing and the 3 generations of history taking. Next slide. Counseling, as I told you previously, we are going to counsel what characteristic does affect degeneration and what are the modification in epigenome and every sort of things, DNA methylation, histone mutations or DNA mutations, RNA, M mutations, everything. Madam, please, next slide. Please move forward faster. Next. Now, understanding the genetic mechanism, there are 3 types: genetic mutation, gene expression, and epigenetic. Next slide. Gene mutation is a direct mutation into the DNA. The 3 basic mutations are base substitution, deletion, insertion, and germline is gamete related, somatic is other than the gametes. Gene expression is on and off of the function of the information that is into the DNA that has to be expressed or not. Next. Epigenetic, here the perspective of looking towards the epigenome has been changed. This gives us the period where we get the disease, where we don't. Some people show it in early stages, some don't. This is DNA methylation, histone modification, non-coding RNA. Next slide. How diet affects some bioactive component does influence gene expression, that is DNA methylation. Also, please, next slide. Also, some exercises to affect DNA methylation. In a study, we have observed that prudent eating habits and Western eating habits, prudent showed more better results than Western. And environmental factors which cannot be changed, such as soil. Like a small example I can give you over here. Avocado grown in India have very bitter taste, and outside India, which has been imported to India, do have a sleep test. This is because of the genetic factor. Same belongs to the human being, same with the human being. Next slide, please. Palavina, next slide. This is a study of genetic susceptibility, how your genes have been affected due to any sort of environmental action or genetic or computer use. TV viewing has shown some increment in cardiovascular diseases. Computer use has no increment in cardiovascular diseases. But if you see for the genetic risk, the risk is too high as compared to the age and time period. Please next slide. Here we have to check. In the patient's detailed relevant history, patient complaints, assessment, and investigation advice for us to, madam, please wait, for us to encounter the actual main cause of the genetic factor, if any, is affecting to the cardiovascular diseases. Next slide, please. What we can do over here is we can support them medically, low calorie diet, balanced diet, Panchakarma if required, keen observation, how the changes have been treated, good prognosis or not. If there is any signs and symptoms, please provide the proper instruction and guidance for any of the changes that has to be made in lifestyle so as to get the better result. Next slide. The result, we can see over here that there is a huge response of genetic over the diseases. We can change it. If not today, the next generation will get benefit of it. The previous generation may have ignored it. This is why maybe this generation is suffering. The very next will get benefit if we start it right today, right now. Next slide, please, ma'am. Since a longer period in Ayurveda, it has been discussed Ahar Vihar, after this, and that is, as it is told, what we see is unproven or it is not true. That we have been proving today with the help of modern technology, that with Ahar Vihar, we can take care of the disease and can make our patients free of diseases. Please, next slides. Madam, next. This proves that there is a relationship between cardiology and medical genetics with the change in diet and lifestyle modification. Some Panchakarma, some help of medicine, we can make our patients free from diseases. A prudent diet that is balanced one, which would be of taking care of ourselves, our diet in a proper manner, not to argue, whatever is required, the amount of water intake. Madam, please, previous slide. The amount of water intake which is required by the body and not the excess one, not enough to make sure that our body survives in a well position. This should be our first line of treatment. This is prevention. If we prevent it, later generations won't be affected so badly as we have been seeing. Like after Corona, we have seen many cases getting cardiac arrest, CNP, DCL. This can be avoided if we take right steps right from the beginning. Thank you. Next slide, ma'am. These are some references. Please next slide. Continue. Thank you.
Thank you, ma'am. And I guess hereditary or congenital disorders are very well executed. I mean, brought forward with her presentation. Over to you, Rahul sir. Any questions?
So, Dr. Rohini, very courageous and very informative topic that you have chosen. It's a really good research question for the future, that if we can have some patients' genetic expression studied before and after the dietary intervention, that would make it a good research presentation. So maybe you have presented a good research question here. We need more evidence to make any any claim or any kind of what I can say, a conclusion, the forward conclusion from this. But you ignited a very good topic.
Okay, so there is a research been already provided. We will get it on PubMed. The research says a prudent diet eating and Western diet eating,
Yes,
people were compared.
Dr. Rohini, this point is very well known, but when it comes to yes, it's very well known, and even in earlier session, Dr. Madan sir has also pointed out the same points, and I would like to congratulate that you have initiated this in Madhavbag by the learning, or you have shared this information with the rest of the doctors. I request you to gather the information on the kind of a genetic expression. Maybe the next time, whenever you will be coming, and that will be the outstanding research. What I'll say, but congratulations to you and all the best, and thanks a lot for putting light on such a very needful topic. Thank you.
Thank you, sir.
Thanks, Dr. Rodini.
Thank you, ma'am.
Calling ahead our next presenter for the day, Dr. Neeta Hinge. Yes, Neeta ma'am.
Yes.
Can go ahead.
Yeah, thank you, ma'am. Thank you, Prajakta ma'am. Good evening. Good evening, all mentor and all presenters. I am Dr. Neeta Hinge from Madhavbag Karvenagar Clinic. Today, I am going to present about the role of Panchakarma, diet and oral medicines in the management of the diabetic neuropathy. Diabetic peripheral neuropathy is the degeneration of myelin sheath typically affects the hands and feet. It is a very common complication and occurs in 50% of diabetes patients. Clinically, it is a destructive disease of the peripheral nerves leading to symptoms like pain, paresthesia, or problems arising from neurological deficit. Normally, glucose is converted into fructose, which is the storage form in the body. During this process, free radicals are generated. In hyperglycemic state, more glucose to fructose conversion happens and excess free radicals are generated. These free radicals causes oxidative stress leading to biomolecular damage, diabetic complications like diabetic neuropathy. Moving on to the case. A 68 years old male patient came with a complaint of uncontrolled blood sugar, tingling and numbness in both hands from 6 months and wants to stop exogenous insulin and improvement in the tingling and numbness in both hands. He is a known case of diabetes type 2 from 29 years. He is a ischemic heart disease patient from 2000. Now, moving on to the on examination, the vitals are BMI was 23, BP was 122/73, heart rate was 77 per minute, BSL random was 401 mg per dl, HbA1c was 11.8, abdominal girth was 92, ECG shows a T abnormal in lateral walls. Considering the history and the vitals, we designed a treatment plan which included Panchakarma, diet, and oral medicines. Panchakarma included Abhyangas, that is centripetal oleation with neem oil, Swedan, that is thermal vasodilatation with Dashamur decoction, Basti, per rectal drug administration with the decoction of Gudmar, Daru Haridra, and Yashti Madhu. Diet was 800 kilocalorie, moderate protein, moderate fat, and low carbohydrate diet. Oral medicines included Ashwagandha, Amalaki, Haridra, Daru Haridra, and Banaba. After completing the 3 months treatment, vitals improved to be BMI 21, BP was 100/60, heart rate was 77, BSL random was 136, HbA1c was 6.4, abdominal girth was 88, and ECG changes are same. Allopathy medicines, first day, Nervac once in a week, Ecosprin AV 75 HS, tablet GP2BD, the tablet Vilda 50 mg BD, and injection Novomox 28 units in the morning and 18 units at night. Latest medicines are Glycomed GP 0.5 and Ecosprin AV 75. Let us see how the treatment plan exactly works. Panchakarma and diet given for 3 months. Panchakarma Abhyanga with neem oil helps to reduce the microvascular damage, reduce the myocellular fat deposition. Swedan, that is thermal vasodilatation, dilates blood vessels, removes fluids, salts, and toxins from the circulation. Basti, that is per rectal administration, it improves the regeneration of the islet cells. Oral medicines helps to improve the glucose uptake, decrease gluconeogenesis, has an anti-inflammatory and antioxidant action, revitalizing action on the nerves, and diet helps to control hypoglycemia and reduce the exogenous insulin. This case study shows that Panchakarma oral medicines and diet proved to be beneficial in controlling HbA1c level, and HbA1c level controls in turn help to reduce the diabetic neuropathy. And patient expectation completed on after 3 months, that is the patient is free from the tingling sensation and her insulin is totally stopped. Now he is on only oral medication, that is a minimum medication, and he is very happy. Thank you.
Indeed, ma'am, diabetes is more dreadful cause of its complications, which all it has. And over to you, Rahul sir, for expertise.
Yes, Dr. Neeta, congratulations for your perfect results. Yes, and the patient now is free from the neuropathic pain. That is the most best outcome of your study. Yes. I have one question: why his Ecosprin AV is still on?
Yes, sir. Because her cardiologist says, "Don't stop this tablet."
Okay.
And what from is your my side. From my side, I advise patient to stop the Ecosprin also. There is no problem because if the glycemic control happens, then the chances of the vascular damage are also stopped, and obviously the chances of the plaque formation is also stopped.
Okay, thank you very much, and all the best.
Thank you, sir.
Thank you, Dr. Neeta. And and calling ahead our next presenter for the day, Dr. Trupti Pathare. Yes, ma'am. The mic and the camera is all yours. Go ahead. You're not audible, ma'am. You can just unmute yourself.
Dr. Trupti, your mic doesn't seem to be have connected. Can you use a headphone if possible? That will be a little helpful for you. Somehow I have a feeling that your microphone and your tab or laptop is not connecting with each other. Try to use a headphone if possible. That will help you. So these are ways in which digital stress test can be done.
Yes, sir.
No worries. I think we'll take a minute or so. In the meantime, we have both our amazing mentors over here, Dr. Rahul and Dr. Prajakta. I would like to ask you both at this point of time, what would be your advice going on the so many presentations you are seeing? You're seeing a trend developing in. What is your advice to all the doctors? And I'm sure now only they should be ready to start preparing for the 3rd National Symposium and probably the International Symposium also. So Rahul sir, what is your advice to all the viewers?
Yes, Dr. Aman sir, what I feel, since in last 5 years, we took a very big jump. I still remember in the Dubai first symposium was taken and the 4 presenters were there. And now we can see, I think Prajakta ma'am, you was one of the
Yes,
4 presenters.
Yes.
And now we have seen the transformation from the 4 presenters. Now there are almost 103 presenters are presenting here. And the good thing is almost 10 to 15% are now the cohort studies, and 95% are still case studies. The day will come that very soon we will be shifting the entire thing towards the cohort study, and maybe the case study only if there is some good novelty in that case, something extraordinary novelty is there, then that will be that case study will be considered. And also, when we are going for the subjective parameters like a neuropathy, we have seen in Dr. Neeta ma'am's case. So in that time, we should use some kind of a semi-quantitative what questionnaire. When when you are collecting evidences, when you are collecting a data, you should start learning collecting a subjective data in the form of some questionnaire. And there are several scales for a neuropathy. If we could have start using those such skills in your clinical practice, and if you have come across 50 or 40 50 patients maybe in the coming year, so by the next year you will be ready with the 40 50 patients semi quantitative neuropathic data pre and post, and that is going to be a huge leap when it comes to the scientific, for the any scientific platform. When you are presenting a 40 50 patients data with some very renowned scale, that is going to make a huge difference. So whatever we are here right now is definitely we are a better version of our yesterday, but definitely if you want to become a best, we need to upgrade ourselves every day, and this is what the medical science is. Whatever is right now is not a permanent, so we want, every time we want to upgrade ourselves, we have to upgrade ourselves. So I guess we are ready with our presenter and presentation.
Yes, yes. And
Yes.
by the time, Dr. Trupti, can you unmute and check whether we can hear you?
Sir, I'm not able. Yeah.
You are unmuted. Yes, we can hear you
Okay.
also.
Yeah.
And Pallavi ma'am, please do the needful.
Good evening to all the respected dignitaries present over here. I am Dr. Trupti Pathare from Madhava Clinic, Koregaon Park. Sir, can I start my presentation?
Yes, please go ahead, ma'am.
Okay. So my topic for today is improving ejection fraction of a teenage heart attack victim. Next slide, please. So recent shocking death of TV actor Siddharth Shukla at age 41. Comedian Raju Srivastava and famous singer KK has proved to us that myocardial infarcts are not for aged people only. Heart attacks are on the rise in patients aged 20 to 30 years old. Now, 1 in 5 heart attack patients are younger than 40 years of age. Obesity, diabetes, and hypertension are major contributors to MI. Next slide. Causes of MI in young adults. Mainly, it is unhealthy diet, junk food, aerated drinks, no green vegetables, stress mainly related to career, exam, and personal, addictions like alcohol, smoking, and tobacco, lack of exercise, and more importantly, excess workout for lean body or zero figure or hourglass figure without proper rest and nutrition. Next slide, please. So this is a case of a 38 years old male patient. He was working as a senior manager in IT. He was obese since teenage, age 22. He had regular gym workouts and he was very active in sports. He started having chest pain and breathlessness after shifting an AC from hostel room to a lorry. He was diagnosed with anterior wall MI at age 29 by a cardiologist. 2D echo revealed his ejection fraction to be 40%. His CAG showed normal coronaries. Next slide, please. After follow-up with cardiologist and repeating 2D echo every 6 months, EF decreased from 40% to 30%. He developed low EF as long-term effect of MI. Patient developed hypertension and dyslipidemia. Patient was put on medications like ecosprin AV, Ditor 5mg, and losartan 50. Next slide, please. So presenting complaints, patient presented with complaints of dyspnea on exertion, NYHA grade 3, intermittent chest heaviness, weight gain. His BMI was 35, constipation. He was a known case of hypertension from 5 years. He had work-related stress as he was at a higher position in the company. He had sedentary lifestyle.
lack of exercise, and he was a foodie by nature. He was habituated to daily smoking and occasional drinking. Next slide, please. So my diagnosis was chronic heart failure. He had dyspnea on exertion, NYHA grade 3. On stress test, he completed 7 minutes, achieving a VO2 max of 11.8. His termination criteria was dyspnea. 2D echo revealed ejection fraction to be 30%, mild concentric LVH, severe LV systolic dysfunction, grade 1 diastolic dysfunction, anterior septal apical segment of LV or kinetic scar. Next slide. So treatment given oral medications, as you can see in the chart, the following Ayurvedic medicines were given. They were mostly cardioprotective, anti-hyperlipidemic, and diuretic in nature. Next slide, please. Pallavi ma'am, next slide. Okay, Panchakarma done. So we can see central oleation with ARG oil. Next slide. Central oleation. Sorry, I cannot see my slide. Okay, centripetal oleation with ARG oil, thermal vasodilation with Dashmul Kada, thoracic drip with Dashmul Kada, per rectal drug administration with Arjun and Punanava extract. Next slide, please. Diet for weight loss, low carb, low glycemic index, medicated diet was given for a period of 1 month. Milk, dairy products, and non-veg food was restricted. Walking exercise was advised. Patient completed 8,000 to 10,000 steps 5 days in a week. Next slide. So you can see the improvement before and after the treatment. His weight improved from 90 kg to 85 kg. Abdominal girth improved from 118 centimeters to 110 centimeters. His BP improved from 160 by 110 to 118 by 78. He completed 15 minutes with ease on stress test, achieving a VO2 max of 35. After the treatment, he was only on Ecosprin AV. Next slide, please. So this is, you can see the comparison between the 2D echo before and after the treatment. Next slide, please. So after the treatment, his ejection fraction improved to 45% from 30%. You can see he had normal cardiac chambers after the treatment. Severe LV systolic dysfunction improved to fair LV systolic dysfunction. Grade 1 diastolic dysfunction was seen before the treatment, which was not present after the treatment. And along with it, distal septum, apex and apical wall was akinetic. Next slide, please. So how do we prevent heart diseases? We have to have healthy food, exercise daily. We should have adequate sleep, and regular health checkups will help us to prevent heart diseases. Next slide, please. So can the risk of heart attacks be minimized by exercise? The answer is a definite yes. It's time to change from our sedentary lifestyle to exercise and activity-filled life. Next slide. Thank you so much.
Thank you, Dr. Trupti. And indeed, the world today, the entire medical fraternity is concerned about youths been dying of MIs. And I remember when I started practicing in Madhavbag in 2008, there were patients who were like around 60s, 50s. But now what patients I see today is around 20s and 30s being affected with non-communicable diseases. And it's really a matter of concern. And we as preventive cardiologists should definitely help the world to come out of all this. Over to you, Rahul, sir.
Unmute. Dr. Tripti, very nicely presented. I have 2 questions. One, since how long this patient is in your follow-up?
He took treatment for 3 months. Now it will be around 5 months he's in follow-up.
Okay, so is it logical to say that when we can, that the conclusion what you have given and we can prevent the heart attack by the HFRT treatment? Definitely, or this kind?
No, definitely we can do that. We have to have, yes, sir.
No, this patient is in your follow-ups for like 5 months only.
Yes.
So maybe if you have a data of like such patients are in your follow-up for more than 2 years, 3 years, and they are taking the treatment and they are free from ACS and any hospitalization. In that case, we can make this statement. But right now, you have given a very wonderful result to this patient. You improved his quality of life. You help him to come out from that social stress of, because he went into the ACS, and that is a very big mental trauma. And you help him a lot. So that's very noble work that you did. But when it come to the presentation, and when it come to the making a statement when from your presentation, we have to be very careful. Right? First point. Second point, you must be knowing the concept called myocardial hibernation. Right? So when the heart attack comes, the heart goes into the hibernation. It is a self-prevention mechanism or the methodology of the heart to protect itself. So this myocardial hibernation may take the patient into the lower LVEF.
Yeah.
So after heart attack, the LVF is low, maybe because of the myocardial hibernation. And once that wound get healed, the scar becomes very tough and rigid, then maybe he can come back to the normal LVF. And so this can be a normal or a natural phenomenon. So it's difficult to take a credit of improvement in this LVF, right? So these are the 2 points. At the end of the day, what I'll suggest, the whatever the quality make the quality of life, you made a change in his quality of life is remarkable and wonderful. But 2 points you I feel you should consider when you will come into the presentation next time.
Yes.
Thanks a lot.
Thank you, Dr. Drupti. And now I would like to invite our next presenter for the day, Dr. Priyanka Pathare. Yes, Priyanka ma'am. You can unmute yourself.
Good evening, all. Myself, Dr. Priyanka Pathare from Koregaon Park Clinic. My topic is effect of Mukta Pishti Kalpa in resistant hypertension. Next. Hypertension is very common nowadays, and we all know about the effects it is causing. The causes of hypertension could be summed up as fluid overload, sympathetic overactivity, anabolic load, inflammation, and vascular remolding. Next. Types: essential, secondary, isolated, systolic hypertension, malignant hypertension, and resistant hypertension, of which we are looking at resistant hypertension. The European Society of Cardiology defines it as failure to achieve BP control to levels below 140/90 mmHg, despite of 3 antihypertensive medicines, whereas the American Heart Association defines as using 4 or more antihypertensive medication. Patient medical history: 72-year-old male with only complaint of uncontrolled blood pressure ranging from 200/110 mmHg to 180/100 mmHg. He was a known case of DM and HTN since 2 years. He had pulmonary COX 3 years back, prostate cancer 1 year back, and he had the following allopathic medication. Next. Investigations done were HbA1c, that time was 6.4, ABPM, grade 2 uncontrolled HTN, lipid, urea and creat were in normal limits. Next. Treatment given: conventional Madhava treatment was given. Diet of 1000 calorie, low sodium, low carb, high fiber, good quality fats, potassium and magnesium rich food was given. Panchakarma, centripetal oleation with rose oil, thermovasodilation with Dashmul Kada, and parenteral drug administration with Salipani, Prishnapani, Bruhati, and Erindamol in Tiltier was given. Oral medications, mostly diuretic, anti-inflammatory, cardioprotective, and Rudya dravyas were given. Next. Observation after 2 months, the average BP was stuck at around 160 by 90 mm of Hg. At the beginning of the third month, Mukta Pishti Kalpa was started with after discussion with ZMH. At the end of third month, average BP was found around 140 by 90 mmHg. Before the treatment, BP was 190 by 120. After 2 months, it came down to 160 by 100. And after 3 months, that is after starting Mukta Pishti Kalpa, it came down to 140/90. These parameters are as given. Next. ABPM before and after. After the treatment, it was all clear. Result. Next. Result, after the use of Mukta Pishti Kalpa, average BP of the patient, which was stuck on 160/90, decreased to 140/80, tapering all the allopathic medicine. Hence, we can say Mukta Pishti Kalpa is effective in resistant hypertension. Next, discussion. The contents of Mukta Pishti are Gojiva, Brahmi, Shankapushpi, Vacha, Ashwagandha, Malkangni, Sof, Pushkarmul, Lavendula, Jatamausi, Sarpagandha, Mukta Pishti, and Praval Pishti. Next. I have tried to compile the researches which are done on individual contents as well as the gunadharmas of the contents. But to cut it short, please, next, please. Next. 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 To the written part directly. Yeah. Yeah. Owing to the properties of the contents of Mukta Pishta Kalpa, it acts on various aspects. That is, Gojiva is Rudya and anxiolytic, Brahmi, Medhya, vasodilator in action, Shankapushpi, again Medhya and Rasayani. Vacha acts as a Pramati Dravya, which helps to eliminate the toxins from the cells and acts as a calcium antagonist. Ashwagandha has vasodilator effect and helps in adaptation of the situation. Jyotishmati helps to cope up with dopamine deficiency, reducing the lethargy, and acts as brain tonic and has shown antidepressant action. Sof is Pachak and has proved to be to have hypotensive effect. Pushkarmul helps in reducing the swelling in inflammation and acts as a cardiotonic and anti-adrenergic beta blocker action. Lavendula improves the mental health. That is, again, it is made there and helps in reducing the peripheral resistance. Jatamausi, it is known as brain tonic. Sarpagandha helps to reduce the toxins as well as it is the best known hypotensive property. Mukta Pishti acts on cellular inflammation and is Varnya. Praval helps in reducing the pitta. Silicon in it helps to maintain the elasticity of arteries.
Last 30 seconds, ma'am.
Yes, ma'am. Correlating it with Ayurveda, many acharyas has coined the term Vatgat Rikta and Siragat Vat. If we go to see, I try to explain it in a simple way. Components of VP is systolic and diastolic. Heart generates an electric impulse by the SA node, which makes the heart contract during the systole. Vanvyata, Vyanvat, a component of Vat, constantly forces the blood out of the heart and distributes it. Hence, it can be said that systolic VP attained during the contraction is controlled by Vyanvat, and the rate of impulse is controlled by autonomic nervous system via sympathetic and parasympathetic fibers. Thus, heart rate is controlled by the Pranvata, which is situated in the Murdha, that is the brain. Hence, we can say that Medhya Dravyas come into action here. Diastolic is only due to blood flowing through the structures of the heart and blood vessels influenced by the diameter and elasticity of the blood vessels. Autorhythmicity of the heart is due to rapid influx of calcium and sodium ions, which could be attributed to the pitta, mainly Sadhak Pitta, which is situated in the heart. So all the dravyas are mostly Medhya and Hridya, contributing to the reduction of hypertension. Conclusion, Muktika Pishtevati shows significant effect in resistant hypertension. Thank you to all.
Very well compiled. Priyanka ma'am, over to you, Rahul sir.
Dr. Priyanka, although it was just a case study, but you enlighten many of us with the knowledge and the extensive literature research that you have done. So congratulate and thanks for your beautiful presentation, and no question as such. Thank you. Thank you very much.
Thank you so much, sir.
So let's move on to our next presenter and the last presenter for today's session, the 8th session of 2nd National Ayurveda Cardiology Symposium, Dr. Amruta Wadekar. Yes, Amruta ma'am.
Yeah. Am I audible?
Yes, ma'am, you're audible.
Okay. Good evening, everyone. I'm Dr. Amruta Wadekar, Clinic Head at Madhobag Vishrantwadi Clinic. Today's my topic is to study the role of Vardhaman Pimpli Rasayan in pulmonary artery hypertension and CHF. Next. Objective is to study the role of Vardhaman Pimpli Rasayan in pulmonary artery hypertension and CHF. Next, please. Patient medical history. Patient 85 years old female patient having history of DM and hypertension in 2018. Asthma was diagnosed in 2021. In 2023, CHF and PH was diagnosed. Next. Patient was with a history of diabetes, hypertension, bronchial asthma, CHF and PAH. Patient was having day 1 complaint as breathlessness, weight gain, cough, dyspnea, generalized weakness. Present day complaint, as such, no fresh complaints. Patient assessment, patient was suffering from breathlessness, dyspnea grade 4, arrhythmia was present, pedal edema was present, she was pale and weak. In treatment procedures, Vardhaman Pimpli Rasayan was given to the patient for 10 days in increasing quantity and then in decreasing quantity for next 9 days. Vardhaman Pimpli Rasayan was used in our matra. Investigations were advised as CBC, ESR, BSL, HbA1c, lipid profile, urine routine, serum electrolyte, KFT, LFT, HS, CRP, apolipoprotein profile, 2D echo. Next. Diagnosis was severe pulmonary artery hypertension with CHF, arterial fibrillation, asthma, DM, HTN, obesity, and arthritis. Next. In oral medicines, Vardhaman Pimpli Rasayan was given in diet 800 calories with low carb, moderate protein, and fiber was given. Panchakarma procedures were done with Sampurna Hruday Shuddhikaran, in which Snehan, that is centripetal oleation by Arjun Nirgundi Dashmul Siddha Tirthel was used. Swedan, that is thermal vasodilatation by Dashmul Kada, Hruday Dhara with Dashmul Kada, Basti, that is per rectal drug administration by Arjun Punarnava extract liquid. Next. Baseline treatment was Panchakarma, that is Snehan, Swedan, Hruday Dhara, Basti. Oral medication, Vardhaman Pimpli Rasayan. Diet of 800 calories with low carb, moderate protein and fiber. Follow-up was twice a week. In follow-up, allopathic medicines were reduced and the good compliance was given by patient. Next. Here are the improvement parameters in which we can see at day 1, 72.3 kg was weight, BMI was 30.9. Then abdominal girth was 104 centimeter, heart rate was 126 beats per minute, BP was 141/73, BSL was 163 and HbA1c 6.6. After 3 Panchakarma treatments, I started Vardhaman Pimpri Rasayan for 19 days. During that Vardhaman Pimpri Rasayan, Panchakarma were stopped. And then after completion of Vardhaman Pimpri Rasayan, we started again Panchakarma treatments. Next. In allopathic medicines, anti-diabetic, calcium channel blocker, bronchodilator, anti-arrhythmic, diuretic, anti-anginal, anticoagulant, and vitamin supplements were given to patient. Then in Ayurvedic medicine, Rudya, Medya, Rakta Shodhak, Deepan Pachan, Mutra Virichek, anti-diabetic medicines were used. Next. Here we can see the results after using Pimpri Rasayan and Panchakarma treatments. Day 1 weight was 72.3, which reduced to 68.8. Then BMI from 30.9 to 29.4. Abdominal girth 104 centimeter to 96 centimeter. Heart rate 126 beats per minute to 85 beats per minute. BP 141 by 73 to 137 by 82. BSL was 160 reduced to 163 to 125. HbA1c by 6.6 to 6.5, and VO2 max 7 ml per kg per minute to 15.0.5 ml per kg per minute. And here we can see significant improvement in Trudeco, where severe pH was present, that is 70 mm of Hg, which reduced to moderate pH, that is 57 mm of Hg. And there were no complaints. Next. In a part of discussion, pulmonary arterial hypertension is one form of a broader condition in which there is increased high blood pressure in lungs. In this condition, tiny arteries in lungs called pulmonary arteries and capillaries become narrow, blocked, or destroyed. This makes it harder for blood to flow through lungs and raise the pressure within lungs arteries. Pimpri helps to control symptoms of asthma and gives relief in case of breathlessness and bronchitis. Pimpri is very useful in asthma because it has decongestant, bronchodilator, and expectorant activities. This is due to kapha balancing property. Pimpri has deepen pachan properties and reduces arm and expel excessive mucus from the lungs. There is an increase in pressure. Right ventricle must work harder to pump blood through your lungs, eventually causing heart muscles to weaken and fail. Next. So the conclusion is, according to the collected data, it concludes that patient with severe pH, that is 70 mm of Hg, reduces to moderate pH, that is 57 mm of Hg after 19 days use of Vardhaman Pimpri Rasayan. Vardhaman Pimpri Rasayan has beneficial effect in respiratory system, that is breathlessness, cough, and dyspnea. Thank you.
Thank you, ma'am, for this wonderful presentation. And over to you, Rahul sir, for any questions.
Yes, really wonderful presentation, and congratulations for you for such a breakthrough results. This is what we were discussing, Aman sir, ki such kind of a breakthrough case studies if are there, so definitely that will be invited for the next National Ayurveda Cardiology Symposium. So this is one of the breakthrough research, what we can call reuse of Pimpri Rasayan in the chronic condition of pulmonary artery hypertension. There are few areas where we still need to improve. For example, we should put a date when you are presenting the table before and after. So what was the duration when you had done the follow-up to DECO, that has to be mentioned in your slide. Apart from that, there are so many questions in the chat box where I think you can go and discuss with your colleagues. So definitely that will be helpful for all of you. But congratulations, and keep collecting such data. Maybe
Yeah.
next time when you will be coming, if you are having a data of like even a 10+2 data, and that will be enough as a cohort, and
Yes.
as a original article, definitely that will be a huge research. No? Thank you, and
Thank you.
congratulations once again.
Thank you, sir.
Thank you, Rahul sir. Thank you, Dr. Amrita. And with this, we have come to an end with the 8th session of the second National Ayurveda Cardiology Symposium. And I would like to take this opportunity to congratulate all the presenters. Your efforts in treating your patients is indeed remarkable. And I would request Rahul sir to please share the marks of today's presentations. Until then,
Yes.
I would like to just say a few words. You can share your thoughts about all our presenters.
Yes. Just a minute, ma'am.
Yes,
I'm
sir.
sending you the.
I think till then Omkar sir has joined us and he can share his
Yes,
word comments.
actually, I'll request Dr. Omkar sir to have to share a few kind words for all the today's presenters and the total event.
Yes. How many of you believe that last 4 days were awesome days? Just type yes in the chat box. Let's see. Because it was a feast of knowledge and I have enjoyed each and every presentation. So how many of you feel that? Very nice. Superb. We had doctors who were aged, say, around 10 years or 12 years in Madhavbag, and the recent ones too, who were 3 months, 4 months, 6 months old in Madhavbag. So this was a fantastic journey of last 4 days, wherein all the presenters had really awesome presentations, and the results itself speaks about their hard work taken behind the patient improvement. And I'm really thankful to Rahul sir, Aman sir, and Rohit Sane sir to give this platform. Because see, without this platform, it is very hard to present yourself in a scientific way in front of the scientific community. We had fantastic chairpersons and speakers in the last 4 days, including Dr. Jagdish Hiremath sir and Dr. Supriya Bhalirao, and many more had come. Dr. Madan was there. So the best part was that all your presentations were viewed across the world, US, UK, and I think Aman sir is the best person who can tell you how many presenters, how many viewers we had gathered in last 4 days. So this was something very nice about all the presentations, and I really hope to see the future of all of you as fantastic researchers. Ayurveda, up till now, before we came into Madhavbag, I will obviously share this point with all of you. How many of you feel that Ayurveda would definitely grow along with Madhavbag and with the way of thinking of research presentations and evidence-based cardiology? I think all of you will, be along with me to mention that yes, Madhavbag is one such organization who believes in research, believes in evidence-based cardiology practice. May it be a case of DM, may it be a case of HTN, hypothyroidism, PCOS. We also had some presenters who had some very unique cases like AVN. We had some cases like myocardial bridge, right? There were very senior doctors like Dr. Rupali, we had Dr. Preeti Sarbere yesterday. So we had some fantastic presenters. And I believe each and every 450 doctors of Madhavbag has this caliber to present scientific evidence in front of the world. The only thing which we are lacking somehow is the stage fright. Now, once we just remove this stage fright, the stage is all open for you. The whole world is looking for an option of lifestyle disorders. And I think Madhavbag and the Ayurveda, which all of you have presented in the last 4 days, it is just simply marvelous. So hats off to each and every presenter over here. Every one of you are super physicians, clinicians, and definitely in days to come, Ayurveda has a golden future because the future rests in all your hands. So best of luck, team. Super presentations. I'm very glad as a training head, I have seen some of you doctors, grow from the 0 day till up till now. It's really a feeling like a father gets when a child grows up to that maturity level and वो रोशन करता है नाम अपने माता पिता का. So I'm really happy to see all of you flourish so well. Thanks a lot. It was a feast of knowledge for last 4 days. Best of luck. Over to you, Rahul sir.
Yes, and I think officially we will declare result, and then the last and the most difficult part is the Thanksgiving wala part. So then we will be concluding the session, this entire second National Ayurveda Cardiology Symposium. So Dr. Prajakta, over to you.
Yes, it's time for today's results, and I think all the presenters have given their best. But there has to be one winner. Seeing the marks, it was just like 0.5 difference between all of them. And today's winner, or I would like to congratulate Dr. Jagdish Hiremath for a wonderful presentation. Jyoti ma'am, congratulations.
Congratulations, Dr. Jyoti. Once again, you have nailed it. Superb.
And rightly said by Omkar sir, I think Rohit sir would be more than happy to see all his children growing, and he must be really very happy seeing us all performing in the symposiums and presenting our case histories. And all things, good things come to an end, and so is today's second National Ayurveda Cardiology Symposium. And I think we would surely meet again with more and more presenters. I think 250 doctors from Madhobag would present their cases, their case histories in front of the world someday. And I would like to thank all the presenters, all the participants for such a wonderful sharing of knowledge, digging into the ocean of knowledge. And I'm also grateful to all the chairpersons for giving their valuable time and inputs to all our presenters. Over to you, Rahul sir.
Yes, just a moment. I will like to highlight the efforts taken by Dr. Aman Kapoor sir. Without his support, this 4 days cardiology symposium is not possible at all. So thanks a lot, Aman sir. Superb.
Thank you so much.
The Thanksgiving is my responsibility, Dr. Omkar.
Yes, sir.
Okay. So last part of this event has come, and I'm really thankful to Maharashtra University of Health Science to provide us such a beautiful platform and become the knowledge partner of the second National Ayurveda Cardiology Symposium. I'm thankful to Chairperson of Maharashtra Madhobag Institute of Preventive Cardiology, Dr. Jagdish Hiremath sir. I'm thankful to Dr. Manisha Ghurde madam, coordinator and principal of MIPC. I'm thankful to Vilas Potnis sir, director of MIPC, and along with that, I'm thankful to my National Ayurveda Cardiology Action Team. The faces, most of all the faces are here, especially the ZMH, Dr. Nilesh, Dr. Bipin, Dr. Sadiq, Dr. Mahesh sir. So everyone was a part of. So is this event was not a single person. I could not handle as a single-handedly. It is a group effort. And as the medical writing team was, as an entire medical writing team was there, because we have created the research book of 103 abstract in like 4-5 days, and the entire team was working continuously, like 16-18 hours they were working continuously for making that thing to happen, so that we can inaugurate that with help by the auspicious hand of the Vice Chancellor. And then my backup team, Dr. Praveen Ghadegaonkar sir, Dr. Amin sir, Dr. Omkar, Dr. Suhas Daukar, Dr. Aman Kapoor sir. So they are like an elder brother to me, and they are always guiding me. Whatever I always know wherever I'm going to fall short, they will stand just right beside me. So thankful to all of my buddies. I'm thankful to the moderator, and this year we view the very the new skill setup of our moderators, Dr. Prajakta, Dr. Nishcheta, Dr. Jinal Thakkar, then the Dr. Suhas Daukar, and I think
Dr. Arunima.
Dr. Arunima ma'am. So I hope I'm not missing any name. So this is a completely new force, and is complete, and Dr. Nilesh, and this is completely new force, and it's absolutely make and made in Madhavbag team. This is absolutely make and made in Madhavbag team. So thanks a lot, and I'm thankful to all 103 presenters, because what we have observed this year, every presenter, like Dr. Priyanka Pathare has presented the Muktika Vati. I think she studied more than me when she was presenting her presentation about the Muktika Vati. And this is how all the presenters did a wonderful literature review. They upgraded themselves very well. And I'm thankful to all the presenters and the participants. More than 750 delegates are there, and they are viewing us on this Zoom platform, as well as this event is live on LinkedIn as well as the YouTube. So we are having a huge viewership. Not only now, but even after the conference, this link will be always available there. So definitely we are making a path for our future generation also. I'm thankful to the I cannot use word thankful, but the parent of all the doctors who are here, Dr. Rohit Sane sir. I still I can tell you this thing, that every night after the 10:30 he is calling me and asking me कि who किसने प्रेजेंटेशन किया, कौन कौन था, कैसा हुआ प्रेजेंटेशन, याचं काय झालं, त्याचं काय झालं, how was the chairperson. So he is very keen to know each and everything and who presented what. He had that interest. So every day he is calling me. I still believe he must be here somewhere, because डॉक्टर साने सर किसी के आईडी से वो लॉगिन करके वो बीच बीच में आके देखते हैं सेशन. सो मैंने ये बताया नहीं, सो आई डोंट वांट टू मेक एनीवन कॉन्शियस हियर, but he is coming and seeing the conferences all from the as a viewers. But I'm thankful to Dr. Sane sir. Because of him we are able to reach to this level, and all the chairperson, because without you this was very difficult to make this event successful, especially Dr. Madan sir, Dr. Bhaspati ma'am, Dr. Gupta sir, Dr. KK, Deepak sir, Dr. Ekta ma'am, and Dr. Bagga sir, and my other co-chairperson from Madhavbag, Dr. Omkar sir, Dr. Praveen sir, Dr. Gurudatta sir. So I think this is going. This was the biggest Thanksgiving talk speech I will say. But actually, there are so many people behind making this event successful, and from the bottom of my heart, I'm thankful to everyone, and hoping for the best. And the next year we are going to have the 3rd National Ayurveda Cardiology Symposium, and I'm damn sure that is going to be the much better than this one. So thank you once again.
Thank you so much, Rahul sir.
Bye-bye, everyone. Good night. And that's it that's a wrap. Thank you so much to Rahul sir, the spearheading person of the whole symposium. And thanks to all the viewers. Stay connected, share this, let the knowledge flow ahead. And good night. Goodbye. Stay healthy, stay fit and fine. See you all.